Well, hello and welcome to the Change Coaching Center podcast. I am here with Dr. Maria Lang again. How are you doing?
I am well, thank you. Thank you.
Awesome. And today we're going to be talking about diabetes, right?
Yes,
All right,
diabetes.
let's go. Talk to me. Let's talk about it.
Well, diabetes, first of all, how about if we got into some stats about diabetes
Yes.
to educate people about it?
Yes.
First of all, diabetes, in America, there's 35 million people who suffer from it.
Holy crap.
Yes, 35 million. And 1 out of every 5 people who have diabetes, they're not aware of it.
Yes.
Okay. Yeah, so that's why we're here today, is that 1 out of every 5, that one we want to capture and tell them what the symptoms are, because it's a long list. It's like an open fuse. When you have diabetes, it just lights this fuse of so many other symptoms. We're not just talking like 5, 10, or even 15 different symptoms. And a lot of people out there are not aware of it. So that's why you and I are here today, to the awareness. And also your pre-diabetes, there's 38% of Americans that have it, and then there's another 11% that do have diabetes. So that puts us at the stats of 39% of Americans have diabetes. So that means every other person that you come in contact with has diabetes in America.
Jeez, that's a lot. But what's the difference with the pre-diabetes? What do you mean pre-diabetes? Like, what does that mean?
Well, pre-diabetes, we're gonna get into that today. The difference between the two. So the difference between the type 1 diabetes and type 2 diabetes.
Yeah, go ahead. Show me.
Okay. So the difference between type 1 and type 2 diabetes is. So diabetes, we have type 1, and then we have type 2, okay? So the question is, type 1 is early onset. So childhood disease, juvenile.
So you're born
yes.
like with the diabetes.
You're born with type 1, okay? So that is the diagnosis, okay? And then type 2, the diagnosis is adult onset. Sometime in your adult life that you will have it.
Got it.
Okay. And then for type 1, it's insulin dependent. But before I get there, it's an autoimmune disease.
Oh, I didn't even know that.
So type 1, yes, type 1 diabetes is an autoimmune disease. That is a type where for treatment, you have to do lifelong injections, right? Because with autoimmune disease, what it's doing, I can tell you something that could be parallel to it. A lot of people are more aware of thyroid disease. When you have Hashimoto disease, where the good cells kill the bad cells, and it goes back and forth. So that's what happens with insulin. You're not getting any insulin inside that cell.
So when you're type 1, no insulin is being produced
whatsoever inside the cell, and in order for the body to do anything. So that's why it's also called juvenile type 1 diabetes, okay? And then type 2 diabetes, it's unknown of why people do it, but we're gonna get into that because treatment is injections for type 1, but treatment for type 2 would be your diet. So a low glycemic diet, which we're going to get into. Your diet, exercise decreases those hemoglobin A1C levels, and we're going to get into that today. Okay, exercise, and then your just lifestyle habits. So that is the difference between type 1 diabetes, and then we have type 2 diabetes.
So type 1 we really can't do anything but take medicine about, and type 2 is more something you can control a little bit better.
Yes, but with type 1, you can do diet, exercise, and make some lifestyle changes, meditation, and you can, when you see your oncologist or when you see your primary care physician, sometimes they decrease. If they prove it long enough with a blood chemistry that they do, they can decrease the injections instead of, as we get older, we're going to become more dependent on that, and there is side effects becoming more independent on the insulin.
Got it. Okay.
Okay?
All right.
Thank you.
Woo! She did it. No, that was good. Thank you very much. So those are the two different types of the diabetes that we got to work.
Yes, yes. So you were telling me you care to share your story about it because diabetes is a silent killer.
Yes, definitely.
And again, that's why we're here today, and it's really important not only in the United States but in the world too.
Yep. I suffer from diabetes, and my dad and my mom, everybody in my family basically suffers from diabetes.
Do you have type 1 or type 2?
I have type 2.
You have type 2?
Yes.
Okay.
Yes.
And your father has
type 2 as well.
Type 2, okay.
And I found out I was diabetic at 28. 28. And
how did you find out?
Oh, I was always sick. I was 320 pounds. I was always sick. Every other day I would faint, and I was having issues using the restroom, and I went to the doctor, and the doctor
urination.
Yeah, well, the other way. And the doctor checked me and he said, well, there's nothing wrong down there, but did you know you have diabetes? I'm like, no, what are you talking about? He's like, yeah, you have diabetes and it's really bad. And I'm like, I don't know what's bad. He goes, your sugar tested at 680 or something like that. And
wow.
Yeah, and I'm like,
that's your insulin.
Yeah, and I didn't know what that meant. Again, not knowing, I had no idea. So I asked him, what does that even mean? He goes, well, the normal is 90 to 100.
So he's talking about your glucose. Your glucose goes up to 100 because we're going to go into the foods today.
Well, mine was at 5 to 6
wow.
every day. Every single day. I was in really bad shape. So I ignored it, right? Because I was going through didn't have money. I was going through a lot so what was I going to do, right? And he didn't tell me to do much. He just told me, I got to get it checked out. They sent me home, and I moved here to Orlando, and I was getting even sicker. I was always tired. I was always throwing up. Nothing that I ate. Every time I ate, I felt like I was going to faint. So I finally went to the doctor and got
the same doctor?
No, now it was here. Different doctor.
Okay.
And they checked my A1C.
Hemoglobin A1C.
Yes. So I didn't think nothing of it, left, and they called me in. And they came in, it was weird. It was like they were angry at me. And that's what and anybody that has diabetes and deals with it could understand. People get angry at you, like doctors get angry at you because it's your fault. That's how they see it, right? So unless you get a good doctor. So this doctor came in and said, very angrily, and said, well, now you have to start insulin. So I'm here to teach you how to do insulin, and she takes out a needle. And I'm like, what is going on? Like, what do you mean? I know my father uses insulin. Why would I need insulin? She goes,
so they're going to start in a course of injections.
Yes.
You have to inject yourself every single day for the rest of your life.
Yep. Teaching you. And then she told me, well, your A1C is 11.7.
Wow.
Yeah.
So being diabetic is 6.5. Pre-diabetic is 6.7 through 6.49, and optimal is 5.0.
Yeah, so I was in trouble.
11.0.
Yes, I was in a lot of trouble, and she still didn't explain the difference. Like, I didn't know what that 11 meant, even after I left there.
It's really high.
So she was like, with an attitude, like, yeah, it's bad, and now you have to take injections. So I said, okay, so small injection, two times a day. And they also put me on 2,000 milligrams of metformin a day.
Yes.
So, and there was a shot, an experimental shot every week. I don't know what it was. It helps you lose weight, or I don't know what it was. So I was on a lot of medication, and I got very depressed. I became very, very depressed because I see my dad dying. He's dying. He's dying from this. And right.
So your father's been terminally ill do you mind telling us?
It's been for a long time. But now he's on hospice. It's done.
So
He's
he's been on hospice for how many weeks? I'm sorry.
now it's been like probably a little bit over 8 months. So
8 months.
6 to 8 months, something like
And
that.
it's because of the insulin.
Well,
Diabetes.
that's the thing with diabetes. It's very weird, right? Because he's not dying from diabetes, but
But
his
it
body
opens
parts,
the
yeah, his
fuse.
body parts are failing. So he's dying. He had a transplant. I don't know if it was the liver or he had a transplant and it didn't work. So he's dying from other things, but it's the diabetes that killed those body parts. So when I left that place, I was like really depressed because they didn't tell me what to do. They didn't tell me how to eat. They didn't tell me none of that. They threw medicine at me, and they were very mad at me. And they told me, "You are going to lose your legs. You're gonna die early of a heart attack, and that's that. So take the medicine every day
Wow.
and have a nice day." I went home and I
So
got
they gave you
depressed.
no tools to take care of yourself.
Nothing.
Okay.
What I got from it is I'm dead. That's what I got. What I got from it is I was alive yesterday, and I'm dead because what she's telling me is that there's no they use the word there's no cure. So I'm done. I didn't even know the difference, which you just explained, between 1 and 2. That should have been. I think that would have helped me know that I can do something about it. Right? I didn't know that. So
Yes.
that was
Even
it.
if you were type 1, 2, you still could be working at, so you don't have to increase the insulin.
Yeah, I didn't know none of that.
So tell me what happened like within a 5-year period of that or a 10-year period. What did you do with yourself?
Well,
What did you learn?
I got tired of the insulin because the insulin was making me gain more weight.
And giving you belly fat?
Oh yeah,
Yes,
it
so
was.
anytime you go on injections, you're going to get more belly fat. Okay.
So I wanted to stop this, and then my dad was getting worse. So I'm like, I have to do something.
So you're watching your dad, and that was
Die of what I have. So this is where I'm going. Yeah, this is where I'm going.
Get more passionate about it, and like I have to find out what this disease is.
Yep.
This fuse that opens up other diseases. So you started getting other illnesses, is what you're saying.
Oh yeah,
right?
my
Yes.
blood pressure was out of control.
Blood pressure,
I was always in pain. My legs were always in pain.
swelling,
I
numbness,
was 300. You want to see my pictures of 320 pounds?
Yeah.
That's me.
That's you.
That's me.
320 pounds.
Yeah, but
and you were type 2 diabetes.
Look at that.
That's you. Wow.
Yeah, that was me. That was me. So I didn't like that.
Thank you.
I have this thing that I couldn't control. So I started going to different doctors, and I got the same results. They would get mad. They would get mad like, this is your fault. I remember once, one doctor was like, I was like, I really want to do something. I need to do something. I don't want to have this. He goes, well, it's too late for that. You ate too many McDonald's already. I'm like, okay. It still doesn't tell me how to fix this. It still doesn't tell me. So a lady talked to my wife. My wife was very shy because I was very depressed. And she talked to this lady, and she was talking to her about me. And the lady said, well, I have diabetes and it's under control. So he could control it. And she's like, how? She gave her a number to a doctor. Chronologist? What is that called?
Endocrinologist.
Yes. And she said, tell him to go there.
Okay.
So I go there, and I went there very upset because I thought I was going to get the same thing. I was tired of these doctors just not giving me the information I needed, treating me like I'm dead, or treating me like I'm that's it. Yeah, I was pissed. So I sat there pissed, and I was a smoker as well.
Okay.
I was a cigarette smoker, so I'm all out of control. So I sat down with this doctor. He came in, very cool guy, and he did it differently.
Very cool, you said?
Very cool guy.
Okay.
I mean, this guy changed the direction of this for me forever.
Yeah.
So I walked in and he
So
goes,
he's an endocrinologist.
yep.
Okay.
But he believes in natural medicine. He uses both. I don't know if we talked about the 50-50.
Yes.
He uses both. So
he does the red and the blue pills,
all that stuff.
Conventional medicine, and then he does the Eastern medicine.
Yep.
May I say?
Yes, he does. So I sit down and I'm pissed. And he walks in the room and he goes, okay, so I know what you think I'm going to tell you. I'm like, what? He's like, you think I'm going to tell you to stop eating? I'm like, of course. That's what you're supposed to tell me. He goes, no, don't stop eating. I don't want you to die from not eating. That makes no sense. And I laugh. I laugh. I'm like, yo, wait, I didn't think about it. Yeah, well, I would die, wouldn't I? He goes, yeah, you would. So he goes, what I'm just gonna do is teach you a little bit how to eat a little better. That's all I'm gonna teach you, and eventually you'll get there. And he says, you do smoke. Don't worry, I'm not gonna tell you to stop smoking either. And I'm like, what? What is going on here? You know, everybody makes me feel bad. He goes, you can't stop smoking right now. He goes, smoking is something that's going to give you issues later on, but right now you have a problem right now.
It's not the root cause.
And by stopping smoking, you're going to gain weight. You're going to eat more. So it's not the time. You should stop smoking, but not today. Today, we're going to work on your eating. It was different. And he had a conversation with me. He showed me about these seeds. I don't even remember the name. These seeds that you drink water, and it fills up your stomach. Flax, I have to ask my wife, but showed me about that, which I started doing. He showed me how to just start looking at what I'm eating, because there's something about people when you're overweight that people don't understand. If you ask an overweight person, if you tell an overweight person, stop eating, just stop eating, you know what they'll tell you? I don't eat a lot all day. That's what they'll tell you, because that's what I said. And that's what everybody I know that's overweight says, because we don't know how much we're eating. We don't have any idea that we're eating so much and so badly. So that was the first thing I did. I started writing down all my meals every single day. And what I noticed at the end of the week is like, wait, what? I ate all this? I don't even like that food. Why am I eating that? Because it was there. So that's what started my thing. And I started working on it. And I went on a challenge to get off the insulin.
So what was your challenge to get off the insulin?
I needed to get off of the insulin within the year.
Things that you did.
That's one. Pay more attention to what I was eating.
Your awareness to your food.
Awareness. So I would write down.
How did you do it to like a budget? Because earlier you said that you did not have enough money.
Yeah, it worked out great, because now I wasn't buying a lot of food. I was buying much less food, because what I noticed is that I swear to you, I didn't know I was eating like this.
Calories is what you're saying.
Yes, okay. I started counting them. I started counting them, and I started finding. He started teaching me cheap ways to go on a diet. Cheap ways to go on a diet. See, I didn't know. One of the things that I did when I found out I had the diabetes, I stopped eating meat and started eating cereal, thinking that was the best course of action. It's not, right? It's
high glycemic food.
Yeah, but I didn't know that, so I was making it worse.
A lot of people don't know that.
Yeah, that. When I tell you about the education, that's what I'm talking about.
Yeah. The first thing people say is, I'm going to go on a diet and I'm going to have these rice cakes. Did you know that these little rice cakes, glycemic index, you just said your glucose was 600, right? Yep. Okay, so glucose goes up to 100, right? So for these rice cakes, they're on a high glycemic of 77 glucose. That's high.
God.
That's a high. These people are trying to, say, I'm going on a diet.
They're going the wrong way.
They're eating high glucose food. So that's what I'm understanding from you is when you were eating high glucose food. So you were just putting more insulin outside of the cells, forcing it outside the cells and putting it into the blood. So what you were doing is causing the high glucose.
Yeah, but I didn't know that. That's where I tell you. And I was seeing doctors every month for my medicine for diabetes, and no one was telling me this. I'm talking about this was probably 2 years of me going through this, and nobody's telling me. Nobody's telling me what I'm supposed to be eating, what I'm not eating. I had no idea. Let's think about this. My parents, you would think, well, this common sense, right? My parents have diabetes and they're dying from it. What can they teach me how to not die from it? They can't. They're dying from it. So who's teaching me? No one. And this is happening, especially me as a Hispanic. It's happening a lot. A lot. We eat the way we eat is our food from our moms and our dads. My mom would cook a big thing of food, and we don't know that that's bad.
Well, also the food chain, we won't get into that too much today, but it has changed that, rice is a high glycemic food or moderate. But the interesting thing is not that I'm going to tell you to go eat a potato because it's a high glycemic. Not that I'm going to tell you to go eat this rice. Even brown rice is high glycemic, okay? But a lot of people don't know this is, if you've heard of ACV, apple cider vinegar. Let's just say now when you eat a high glycemic food, you could actually put, like, for instance, if you put apple cider vinegar, that will balance out. You know what I'm going to say,
Yeah,
right?
that's
That will balance out the glycemic index
yeah, that's
when
what.
you're doing foods, and that's what people need to learn. You know, we've heard about, put a protein with the oil. That helps balance out the glycemic index. So
God.
when you're doing foods, I mean, not that you can't have anything in the moderate or the right,
Mhm.
but you could use another food to balance it
Yes,
out.
he taught me that with the vinegar. I,
Oh, okay,
I,
okay.
I didn't know. I put it. I
You
started
look at me
eating.
like excited when
Yeah,
I
because
said that.
I started putting that on everything. I don't care how nasty it was. Vinegar became really. I used a lot of vinegar, and I still do. And
Yeah.
everything I eat is high vinegar. And he told me to do
Well,
that.
just watch your teeth. If you ever drink it straight,
Oh no, I
have
don't
one
know.
of those
Maria,
have one of those wooden straws
that's
because it's
disgusting.
going to
No.
ruin the enamel.
Okay.
Oh, some people do.
I'm
Well,
not.
they put it in a little bit of water and they'll have it like in the morning or night. That's what my patients will do. But I tell them to use a straw sometimes
No,
too,
I
so you
can't
don't
do
ruin
that.
the enamel.
It's
But
disgusting.
yeah.
But it work. I put it like if I eat salad, I don't use ranch dressing. I use vinegar.
Yep.
Vinegar and salt and
And of
pepper.
course
And
your
that's it.
oil, and we have here today avocados.
Yes, I eat a lot of that.
Low
Yes,
glycemic.
yes. What
And then
else?
in your salad, since we're talking about your salad,
Yes,
Dr. Gaba, onions, which are low glycemic.
yes.
Now, your peppers,
Love
only,
it.
you're talking low glycemic index. Did they tell you what that is?
No, but I eat that. He told me to eat that,
Okay,
so
which
I
is
eat a lot of that.
20 to 49 is considered a low glycemic if 100 is a high glucose, right? So things like this, but then you go into your medium glycemic. Let's say those you like fruits.
Yes, love
Okay,
fruits.
so fruits you really only with diabetes or anybody you only need 1 to 2 fruits
Yep.
a day. Okay. So your fruit, something like this would be a medium glycemic index. Okay, so this is a peach, and then your grapes here,
Love grapes.
yes, but just remember, not all of these grapes are one serving. Okay,
Mhm.
15 grapes are one serving, but this is a medium glycemic index, only a 53. So your medium, but there's a low, a moderate, and high.
Okay.
Okay. So I just told a new patient the other day, just stick between low and moderate just for 2 weeks because they were always in the high.
Mhm.
Okay. We got to make small changes.
Yes,
But
small.
yeah, so this is so the moderate glycemic index is 50 to 69. So this is 53. So yeah, even your carrots, they are medium glycemic index too. So these are things when you're doing your apple cider vinegar. Now, I'm going to tell you something about bananas. We always hear about watermelon. We hear about bananas. Bananas are medium and high glycemic index. Did they tell you about that?
Depending on how you eat it, right?
No, actually, well, you
Like if you eat it in a shake, if you
So-
break it down, it's higher, or
well, what I was discussing, if it's unripe, it's a moderate glycemic index.
unripe. What do you mean?
Which is
if
green.
it's
Yeah,
Oh.
if it's a green or just turned
So what if
yellow,
when it
that would
turns
be a moderate glycemic
okay?
index.
So when it turns sweeter, which is the way I
if it
love
turns sweeter or even just a little speck of a little bit of brown on the outside, you just went into the high glycemic index.
Oh, you see that I didn't know.
Maybe you should pour your apple cider vinegar on it.
No, that's disgusting. What is wrong with you? What is wrong with you? That's disgusting.
So it's called overripe bananas are a moderate, so that's 70 to 100. Overripe banana, 70 to 100 glycemic
Okay.
index. Yes.
So in other words, eat it while it's ripe.
Yes.
That's good.
So some of your fruits, I mean, even raisins. Raisins are a moderate glycemic index at 64.
Oh, I
Think
like
about
raisins.
that. Yes. So those are things. And then let's see, our rice cakes we said are 77, and then you're better off having that ice cream than having like your baked potato. I mean,
That's
like
what he
85.
taught me. That's what he was teaching me because I had the wrong concept about for me like that. I'd rather
The baked
not eat.
potato.
I'd rather eat the baked potato than the ice cream. You understand what I'm saying?
Yeah, but your ice cream is
But he taught me that's not what I'm looking at, and that's what I started doing. I started smaller portions. So whenever I get a plate of food, cut it in half. I would only eat half of it. I started doing that immediately, and fasting. I do a lot of fasting. So when I'm getting carried away, like the holidays, I got carried away because I mean my wife
Well,
cooks
that's what
really
a lot of
good.
people do.
I fast, and I fast once to twice a week, depending on what I did over the weekend. And I just fast, and it immediately brings my weight back down, and it makes me
So
feel
then you're
better.
burning fuel.
Yes.
Because therefore, when you're overeating during the holidays, what happens is the glucose goes so high and you're not allowing that insulin inside the cell, right? Because
Yeah.
that's the key we were talking about. Yeah.
So now, just to give you the ending of my story, now I'm off of insulin.
Wow.
I'm off of the 2,000 milligrams of metformin. I think it's 5 milligrams of, I can't remember the name, but I'm off of the metformin, and my sugar is always normal. The last A1C that I took was 6, which I know is still diabetic, but 11.7. It's like, and the one before that was 5.
So what is your glucose at now? Now that you're giving your
Normally it's 112, 113.
So your glucose is still at a 112. Functional medicine, ideal range is 85. I mean, because we like to catch it before there's a problem.
Definitely.
Now, since you're bringing up some clinical stuff on numbers, I also want to mention to you, ask you about that too, is so vitamin B6, vitamin B12, and folate, those are measured through homocysteine levels. So if you do know anyone, as we're educating people out there, is if you measure your homocysteine levels and that's high, more than likely your vitamin B6, 12, and folate are deficient.
Oh. So
Yes.
that's something
So
I have
that's
to look
another
at.
marker with diabetes type 1 and 2 that you want to get tested. So we're talking about homocysteine levels, right? We're also talking about hemoglobin A1C levels, and then we're talking about glucose and then your insulin.
Got it.
Those are very important things.
Yeah, I go every 3 months, so I know it's still high, but it keeps going lower and lower. And now I went high because I changed medication again. So every time I do the medication change, it does jump a little. But I mean, I'm not 11.7. You know what I'm saying?
But congratulations.
Yeah,
Let me ask you about your
I'm very happy.
exercise. So exercise plays a critical role on, pardon?
Critical.
Yes. I mean, exercise is basically, it's your best friend.
Yes.
So with exercise, you were telling me you started slow.
I still do it slow.
Okay.
I still do it slow. I don't put the pressure on me on that I have to go to a gym, or I exercise where I'm at. So I'll do push-ups right while I'm in my office. I'll wash my car. I'll go for walks. All those things, and it actually works.
Well, how about when you started the program? Can you tell us how did you start off?
Slowly, very slowly. Because
how many times a week did you exercise?
2 times a week.
2 times a week.
Yes.
Good. For how long?
I did that probably for the first 6-7 months, and then what happens is now the
Twice a week. Okay.
And the twice a week now that was nothing. So now I could do 3 times a week, like nothing, because I got used to the twice a week, and that's it. And sometimes I'll do 4, sometimes I'll do 5, sometimes I still do 2. It just depends. I measure everything. So the glucose measure.
Which
I
one
use that. Whatever they give me for free at the moment.
Okay.
So it depends. It depends on my insurance.
Okay.
So I use that as to gauge what's going on with myself. So I take them, and then I think about what did I eat and how much did I exercise the past week, and that'll tell me what I have to do for next week. So next week I have to exercise the 4 days because I messed up somewhere, right? Or next week I have to fast for 2 days. So I use that as a meter for me to know what I have to do to plan how I'm going to handle diabetes. So it's all about planning. That's what's been my best friend in this journey.
Well, and as we all know, exercising is going to help with the insulin resistance. Yep. I mean, I feel it. I'm thankful. I do have juvenile, autoimmune disease, but I'm only hypoglycemic. And I say it like this because type 1 and type 2 diabetes is such a severe thing. And I notice the difference when I exercise. I feel immediate. And another thing too, I have to say with anyone who's, viewers, is always make sure that you bring a little bit of food with you, just in case you do have that emergency and you start working out. You never know if you need something to help with your glucose levels.
I think one of the problems when you're stuck in that it seems like such a big issue. Like how am I going to lose? Or how am I going to lose 200 pounds? Or how am I going to bring the sugar down? It's going to take me forever. And we get stuck in that. So we don't start today. We could say we're going to start tomorrow because it's going to take me years anyway. So I think that's that's one of the issues I was having. Every day was tomorrow because I'm not going to see the results of this for years, right? I'm not going to see it. So I started putting it very small. I don't need to lose. Now I go down to 190 pounds. That's from 320 pounds. So, and it got there faster than I thought it was.
It's almost another person. That's another person.
Yeah, that's actually, I saw a friend, not a friend, somebody I used to hang out with during those times, and they were just like, what? He goes, what happened to the other Julio? I'm like, what other Julio? There was two of you, friend. Damn. That's why I don't talk to you no more. But I started doing 1 pound at a time. I wasn't thinking about 100 pounds. I was thinking 1 pound, 1 pound. This week, all I need is 1 pound. That's all I need. And I would go to 2 without even thinking about it.
And another thing is too, when you're thinking about the pounds, I mean, it's even the symptoms where you're having vision problems, because it's usually what happens is the lens infects the lens of the eyes that get swollen. You were having vision problems.
And I still do sometimes. And I just went to the doctor. I go every 3 months to do my A1Cs. Like I'm on top of it. Every 3 months, I go and do my A1Cs to check what's going on. And I told him my vision is getting blurry sometimes, but my sugar is under control. I don't understand. He goes, oh no, you're still diabetic, my friend. You're still gonna have some of those issues. It's not gonna go away completely. You're just, by being healthy. He called me healthy. I was like, what? He said, by being healthy, it's just you're improving it. It's not gonna be as bad, or it's not gonna be all the time. And I don't have vision problem all the time. It's when I'm tired, or when I eat a little bit too much, I get the bad vision. So it still happens. The legs, I was telling you about the legs. You gave me a great tip. I bought the socks.
Oh, compression.
Yes.
Okay, so another thing for the viewers too also is, so you're talking about when you have diabetes type 1 and type 2, I mean severe with problems with the legs, the toes and that, amputating, or we just get numbness, tingling.
The numbness or pain, even the pain.
And pain, because what happens is the nerves, you get all that blood sugar. The blood sugar is not going inside the cells. The insulin's not going inside the cells, so it's going in the bloodstream. So your nerves are going to get that pain, numbness, and tingling. And you see people's feet where a lot of discoloration. And then you can't sleep at night. I think that's what you're complaining. And sleep is very essential when you have any type of illnesses. Sleep is when you rejuvenate, when you rest. So compression socks, and there's 2 special types, and I'll just say it basic. There's a 20 and there's a 30. So the 20 is not as strong. The 30 is tighter. And I wear them occasionally. I mean, a lot of athletes wear them too. But even if you put them on at night just for a few hours, don't recommend sleeping with them unless your doctor tells you yes. But you're going to find most of the time your doctors will tell you not to sleep with them, but put them on for a few hours.
Yes.
So how did it work?
I'm good. I mean, I still get, but it's not as severe.
As intense. So it should change in time.
And when I do get the pain, I put them on. That's what I've been doing. And it goes away. Like slowly. The pain is gone, and it feels good to have that pressure on your legs. It feels good. So it's awesome. These are the little things that people can do. And
what about, did your doctors tell you anything about a common sign is the liver? So when you exercise, you're pumping, insulin into the muscles and then into the liver.
No, they don't say that. That's what you got to understand. That's what I'm trying to tell you. They don't give you this information. It feels like the information to get better is like locked away, and it's only for certain people, because I don't know this. And I'm diabetic. I've been living with diabetics with diabetes for like 20 years. I still don't know that. I know I have to exercise. I know it does improve something, but I don't know that. And that's information.
So I just ran into someone the other day. Well, a patient came in to see me and just said, look, and the eyes were like wide open. Can you help me? And he says, I have a fatty liver. And I looked at it. I said, it's called a non-alcoholic fatty liver. And that means you're diabetic. So he looked at everything. And the big thing is he went to a doctor, and his primary care physician, and he was having ED. And if you want to wake up a male, and just say you have erectile dysfunction. I mean, and that's the confusion with men. They think they're having prostate issues.
So that's called
but
diabetes.
It's actually a diabetic issue too. So you got to look at the difference between. So like I said, I mean, when you have diabetes type 1 or 2, it opens up this big fuse of health problems, hypertension. You're seeing,
that was
cholesterol.
Mine was that.
I mean, you
cholesterol.
So men ED, and they say, well, I want to be on more testosterone, right? Because, I can't perform in the bedroom, but really you got to be thinking about it.
Fix your sugar.
Diabetes, your sugar, when you're talking
Get
about
it under control.
And then let's just go to women too. Women are usually the ones that are spending the money on the anti-aging, this expensive hyaluronic acid, Swiss apple stem cell, this stuff that I use in my practice. But I try to tell them, if you just take a picture of yourself, just the wrinkles on your face, and just even the tags that you get on your neck, a lot of people, diabetes, a lot of them get the tags in their neck, they're going to the dermatologist and it's not going away. They're going back again and again and again. And it's your diabetes. But if you would just take a picture of yourself, in a room, the same lighting, and just take a picture, even 1 month later, you'll notice the difference of the swelling of your eyes will go down. Your face looks better because you're producing collagen. Yeah. You cannot produce that collagen, and those nutrients won't go through your bloodstream because you know what's going through your bloodstream? A high level of glucose level. What's destroying the body.
Yeah, my face is not swollen. My face was always big.
Better,
yeah, right? So everything works better. I feel good. I wake up in the morning. I can go to sleep at night. It was like a difference in life. It was a different life completely. And I know it's not gone, but I'm gonna just keep doing it.
Gradually, it will. Type 2 diabetes gradually. Even when you have type 1, the symptoms can improve. But type 1, you're really closely monitored with your endocrinologist. But even type 2. But if you keep on going on that avenue and learning about it, you will definitely continue to.
I'm going to tell you, actually, you said something right now. And I before we go, you said, how women, they take the time to, you just said, they work on that. Wrinkles. One of the problems with diabetes, and I deal with a lot of men, is being, how can I say this, being a man. We're used to not doing the self-care.
Oh.
Then it's huge.
Yes.
It's huge, and that was one of my problems. So even though I knew I was freaking I had this problem, I didn't want to take care of it because I felt stupid taking care of myself. I felt stupid measuring. I used to measure my weight. That's how I got it down.
You used to measure waist to hip ratio?
Yeah, that's how, when I was losing the weight, that's how I didn't go by weight because I was also weightlifting. So
could we actually hit that for a second? Because a lot of people don't know about that.
Oh, yeah.
So it's on your major website, Cleveland Clinic, Mayo Clinic. It's called waist to hip ratio. Okay, so if you take your waist, measure just 2 inches above the belly button, measure the waist. And then you divide it by, your hip. So you're going to measure your hip, take a tape measure, and just snug around the widest part of the buttocks. But you measure waist to hip ratio, and there's a scale on your major websites. If you just type in waist to hip ratio on Google, right?
Yes.
And it will give you a male waist to hip ratio, low, medium, and high, and female, low, medium, and high. So the man that came in to see me who had erectile dysfunction, he thought it was, but he found it was diabetic related, right? And a lot of problems even with that, with ED, is men won't share these things
with
their doctors. But what I'm getting, what you're saying, they won't share it. So this problem goes on, and that's what happened with him. He wouldn't share it, that it was causing a lot of other fuses that were just going in the body. He ended up even getting UTI, urinary tract infection too. I mean, it just went out, and then he even ended up in the emergency room. But the root cause
that's when the men do it. That's when we decide to do something about it. When we're in the emergency room, a lot of us, and it's that culture of you're a man.
Pressing on the urethra, so it's causing a problem. So the root cause of the problem was the diabetes. He didn't know that he had diabetes. It was like a 7.0 for hemoglobin A1C, which yours was at 11.0.
11.7. I was dying, right? Or something like that. I was almost out the door.
So that's pretty high. But waist to hip ratio, if you look at that, if I could conclude with that, is you're going to see if you're low, medium, high. And then your question is, what puts you at risk if you're on even a medium or high is you're at risk for diabetes, definitely, cardiovascular disease, osteopenia, and porosis, because the body can't hold up all that weight. So you're just opening, even for cancer, so you're just opening yourself up to the major diseases with that high waist to hip ratio. But that was a really good point you brought up.
Yeah, it was, and that's one of the things I used. I didn't use the loss of weight. I used that mostly because and it worked. And again, men have to start taking care of themselves. They have to stop feeling stupid or feeling like if they're less of a man because that's how you feel. Like I'm complaining. I like you say, I have a UTI. Who am I? Like a man. I don't want to say that to somebody. They feel embarrassed. But there's nothing to be embarrassed.
You know, if you could just say it for the listeners too.
There's nothing to be embarrassed about. It's just for you. You're gonna feel great. Just start taking care of it. I advocate every time I have a male client as a coach. The first thing I tell them to do before we go anywhere is you're gonna go check your sugars. You're gonna go check. You're gonna go to your doctor before we start working. You're gonna go to your doctor. And people, you're like, what do you mean? Like you're a coach, right? You're supposed to teach me strategies on how to work better.
But if you're a really good coach, that's what you're going to do.
You have to do that first. You have to take care of that because if you feel like crap, you're not doing anything.
You're not going to produce.
A lot of people come to me for lack of motivation. And most of the time, half of them, there's not lack of motivation. They have a small problem. Their sugar is too high. It might not be they're pre-diabetic or their pressure's high.
I'm surprised those numbers aren't higher than that.
I mean, they probably are, but not everybody listens to me, right? Because I'm Julio. But still, from what I see, what I'm saying, so that's the first thing I make them do. And they go through that. And then when they come back to me, they're like feeling better and we're working. You know, they're more motivated.
So you just shared your story. Thank you very much.
Of course.
Tell me, you're always going with energy now. Now, I understand with diabetes, you can get these like a cold, where you can stay in bed all day.
Yes.
You have those?
Yes.
How many times a year would you say for people so they understand? Because people don't understand that. They just think, oh, I have this cold, whatever. But they don't understand that they dismiss this as much as we were talking about ED. Now they dismiss the cold and not aware that it's diabetes related.
Yeah, because that's your immune system is compromised with it. So I get colds more often than anybody in my house. And when I'm getting sick back to back, I understand my sugars. I'm not taking care of my diabetes, and that's where I go. I don't go get a flu shot. I go and now eat better for the next 2 weeks so that's what I do. So when I'm getting a lot of colds, that's all these things it's your body telling you, hey bro, come on, wake up.
I have to clap because you've done a phenomenal job.
Thank you.
Your energy is phenomenal.
Thank you.
And I know all of our energy, you can just have a little wavelength, just like
and it does
going up and down.
Is that a diabetes joke?
Yes. You picked up on it.
Of course.
Thank you for sharing.
No, and thank you for being here. Thank you for sharing information. Keep doing what you're doing because you're helping people with this stuff, right? And you got to keep doing it because I'm telling you, information. People don't know this stuff. I learned some stuff today and about the banana. I eat the banana sweet all the time.
Oh, I just thought you put it with vinegar.
No. So you taught me, even somebody that's living with this. So please keep doing it because I'm telling you, you can do something about it, right? You can do something about it.
Yeah.
So thank you for joining us. It was so much fun, and we'll do this again, right?
Yes.
All right. Thank you.